So I think we're going to have these pictures now from your organization's activities. These come up pretty quick, but tell us to stop if you want to comment on any particular ones.
You know, we have a lot of activities in the neighborhood for small children, and we have puppet shows with citizen leaders who do puppet shows. We have a lot of community meetings, and we have people coming in discussing what's happening on their block every month. But certainly, we give people a chance to go to the YMCA. We have fitness activities. That's why this is a good public health month, because not only do we talk about access to medical care, but we also provide an opportunity for people to actually use community institutions better, the park districts and the YMCAs for swimming.
It's a gorgeous facility that you raised the money for.
Yeah, and actually citizen leaders raised the money for this building. We started off with citizen leaders around the table saying that we need to do something to show our kids that we can do more than put demands on them and talk. And so they started having catfish dinners and raised $60,000 as our first dollar to buy that building, to actually start building that building. So citizen leaders, you know, they do a lot of things. Austin is a beautiful neighborhood, and we have wonderful people around the table. This is one of our citizen leader meetings. We have them once a month, where neighbors come out, and when they go around the room, they tell that they are Miss Ada Young from the 5400 block of Haddon. They give good information about what's going on Haddon and what's going on Long and what's going on around their blocks in the Austin community. So we try to weave relationships among these neighbors to really care about their block, but not only about their block, but their neighbors on other blocks, Jackie, as well.
I hate to interrupt you, but this, the room here in particular, I'd like to kind of talk about our technology center and a story. There are times, and maybe this is not a good thing to
go
say,
ahead.
But we have actually, by accident, left the door unlocked. And the interesting thing is that the people in the community know that this technology center is for them, and that they know that they can come in and type their papers and get on the internet. And the real beauty of it is that when we give to the people in the community the things that they need, these are the times when you know that the people love what you're doing for them, because they have access to all of these things.
When we left the door open, people didn't even break in and steal. Right. Folks called up and said, "Oh, you guys left the door open. You want me to lock it?" Right. 12 o'clock at night, you know.
Well, I remember a program, a news tip I think we did at the Community Media Workshop, where you were providing web TV internet access to households that probably wouldn't have even had dial-up, much less broadband or cable. Now that technology's changed a little bit, but you were pretty far ahead of the game.
Every year we graduate about 300 people from the community who have gone through our technology program, and they have huge celebrations. These are people 60 years old who were scared to turn a computer on, but now they're talking to their neighbor down the street about their children. They have set up, and they can come into the office and check on that's what she was talking about, check on their webmail. And they can use our email even if they are not able to purchase a computer at home. So we have been doing this for a long time, and won a DHS Innovation Grants Award from the U.S. Department of Health and Human Services for our work in bridging the digital divide back in '96.
I think too, sometimes, and I'd like to mention that, Ms. Reed, sometimes the community doesn't necessarily tell us all of the positive things that have happened after they use some of the facilities, for example, the technology center. But one woman did come back and say, you know, I was previously laid off my job. That's why I had time to go and take the free classes. And because she improved her skills and, you know, gained this access with the computers, they hired her back. I mean, and so those are the positive things that we can do in the community to help us thrive and grow.
So another reality in the community is that some people haven't graduated from school. They have stumbled. They've ended up having to deal with the criminal justice system. What are you trying to do with the Weed and Seed program to counteract the impact of that in a neighborhood like Austin?
Earlier, Ms. Reed mentioned about people in the community and engaging them in 67 blocks. That's where we kind of began at. And in one of those blocks, there was a gentleman who was a former Jesse White tumbler. He was sitting around the house, really not doing much in terms of being engaged with the community. And one of the organizers went to his home many years ago, went to his home, and he said, well, gee, I didn't know that we needed the help maybe necessarily. And now he has taken the skills that he learned as a tumbler, and then now he's giving that program to kids in the community. And I believe he has about 76 kids now that he delivers this program 2 or 3 days a week, and it's really awesome. Volunteering. I mean, these are. I can give another great example. There's a gentleman. His name is Mr. Lewis, and he was just kind of off work, and he really wanted to do something with the children in the community. So he used some of his own money, and he bought football uniforms for kids, and he started just doing everything that he could to teach kids the skills that he had with football. So one of the things that Austin Weed and Seed likes to do is that we like to find people like that in the community and sow good seeds, so that when community and law enforcement are working together, it's not necessarily that we're going to tattletale that there's something bad going on in the community, but we actually do very positive things, in the community with law enforcement.
We help raise money for example, for the football league, and now he has 97 kids in that football league, and they are part of the Chicago Public School League. And we help raise money for the tumbling team and help him with space. And so a local church gave him space, and he has 76 kids going in there 2 days a week. And when the kids are there, he's mentoring them. He's talking to them about, not getting involved in bad activities and how to stay positive and stay in school. So, we have a number of families in the neighborhood who have really taken on. We have women who teach young ladies how to sew. And if a teenager gets pregnant in the neighborhood, they'll give her a baby shower, but they will also talk to her about how to be a parent, how not to be up and down the streets with a young child, how to feed a baby, how to dress herself and how to take care of herself and help her get back in school. So these are the kinds of things. This is using the capacity of the people in the community to transform the lives of people in the community. And this is giving people hope.
Another award-winning activity was something to try to combat the high incidence of lead poisoning that certain families in the Austin community, many inner city communities. Tell us a little bit about what you did to try to, in working with the city, to try to do something about lead poisoning, largely from paint, from old paint.
Yeah, this was a wonderful project, and I think the city is really to be commended for their work. We work with the Department of Health to go out and to look for families and children who have been impacted by lead poisoning. And also, as Danya was saying, they do the visual kinds of inspections, going down the street, looking to find which houses have these old window panes in, so that the city can go in and actually test to find out whether or not there's a problem with lead paint in those old apartments. And as a result of that, we help the city to identify areas within the community to go in and do a window replacement program. They have an excellent window replacement program. So even if families cannot afford to place windows, the city can help to subsidize that replacement and actually hire contractors for the person to get the work done. But we would go out in big apartment buildings. We'd have Big Bliss. We'd have people from the neighborhood. We would train them on how to go out and knock on doors. We'd have phlebotomists from the city who could actually go out and do the blood draws, and they would test children right there in their home. So we didn't have to burden families, single moms, to come into the Department of Health. We could go and do the testing in their homes, and then the results would come. Then our folks would go back into the family, and we will let the family know what the results meant, what they can do about it. If they need more housing, we would advocate for them to get housing. We would advocate for the landlord to get that problem fixed. So we were there for the family all the way. And it's just been a tremendous asset. We've seen tremendous turnaround in terms of the way we've been able to get rid of some of the lead in some of the housing.